Okay, I'm sorry, you were saying?
So I've seen this happen with neuters before when we remove the testicle, the piece that's tied off and goes back in.
Mm-hmm.
If it gets an infection from any reason, whether it's just because it's open, if they're very dirty, if they're licking, if anything happens that causes an infection, that piece that's back in there, that tends to be where we'll see the complication. For Tiger, my biggest concern is that it doesn't sound like he's eating very well. He has a really significant fever. His belly is very, very uncomfortable. So if that infection tracks all the way into the abdomen, that is a life-threatening emergency. That's going to be kind of our worst case scenario. We'll talk about that a little bit more. That's less likely, but I did want to mention that now because if I find that that's happening, then we would be talking about another surgery. What's more likely is that we just have a really severe infection in a young animal whose immune system isn't handling it very well. I do want to get blood work because with that high fever, decreased appetite, I want to make sure he's not becoming septic from this infection. I am going to recommend we get him admitted to the hospital at least overnight for injectable antibiotics, pain management, and to make sure that we don't have anything that's going on that would require additional surgery. My hope is that we'll be able to manage this as an open wound because there's infection and granulation tissue. It's not something we would close right away. Typically what we'll do is keep everything clean and prevent licking, so we will place an e-collar and then manage as an open wound until things are healthy enough that we're able to close it.
Okay. Yeah, definitely. Whatever you need to do.
Absolutely. So I'm going to put together an estimate for you.
Okay.
Like I said, we'll talk about at least keeping him overnight,
Yeah.
and then we'll go from there. If he's eating, drinking, happy, and we're able to get him on oral meds, we'll get you home with instructions for wound care. If he's...
So are you going to suture him, like, you say it has to be left open for a while?
We're going to manage it as an open wound until the infection is clear, because if
Okay.
we close it right now,
Yeah.
we're just going to trap everything.
Okay.
So the earliest we would talk about, a lot of times we don't have to close these at all. We can let it heal by scarring, but the earliest we would talk about closing it would be in a few days once we have the infection under control.
How did the opening even happen? I don't even understand that.
So what happens is that's where the leftover portion from, so when we remove the testicle, it's on a stalk,
Mm-hmm.
and we ligate, and the piece that goes back in that isn't removed with the testicle,
Mm-hmm.
that's about where it sits. So if that portion either has necrosis or the blood supply is cut off there or there's infection in that area, that's where it's sitting under the skin, so it abscesses out there
I understand.
sometimes.
All right, thanks, Doc. I really appreciate it.
Absolutely. I'll have a nurse back in just a moment with financial estimate for
Okay.
you, and then we'll get everything going.
Okay, thank you.